Every state in the country allows patients to clip coupons from drug manufacturers to offset the cost of expensive brand name drugs, except Massachusetts. Now a bill making its way through the legislature could change that, but critics say we could be paying more than we bargained for. Last August, Michael Rafferty got a call that changed his life. Doctors had a perfectly matched liver for the 60-year-old who was dying from an aggressive form of cancer. Within hours, Rafferty was on the operating table.
I'll introduce you to my battle wounds. Let's see. The scar goes down here and then down. That was 22 staples and like 7 stitches.
With the new liver, though, came an expensive regime of drugs. At first, Rafferty's insurance covered most of the costs, but within months, the nonprofit he was working for closed, leaving him without insurance and paying full price for his medications.
The Prograf is about $1,000 a month. Cellcept is about almost $1,000 a month, and then you add the other medications on top of that.
Rafferty says it adds up to $2,500 a month, a cost that could be offset if the state legislature passes the coupon bill. The bill would lift the current ban on pharmaceutical discounts in Massachusetts, allowing companies to offer coupons to cut the costs of drugs.
The one pharmaceutical company that got me started in this whole process has a program where their coupon would offer up to $2,400 a year.
Massachusetts is the only state that hasn't passed the bill, something Brian Rossman of Healthcare for All thinks is a good thing.
The drug companies are not charities and not doing these coupons to be nice to people. They're doing it to boost their profits.
Rossman sees the coupons as a marketing ploy, getting vulnerable patients hooked on brand name drugs. When the coupons run out, Rossman says patients and everyone else are left footing the bill.
No one gives you coupons for generic drugs. So by encouraging everyone to take the more expensive brand name drugs, that raises the price of prescriptions for everybody.
Rossman says the solution is comprehensive health care reform that makes brand name medications less expensive.
Some of them cost thousands of dollars a month, and that's just a ripoff.
A ripoff for Rossman, but a lifeline for Rafferty.
If I don't take that medication, my body starts the rejection process and I die.
All right, joining me now are Robert Coughlin, the CEO of the MassBio Technology Council, who supports coupons for prescription medications, and Wells Wilkinson of Community Catalyst, who is against it. Welcome to both of you.
Thank you, Emily.
Well, as you know, this thing really started back in 1988 when Massachusetts signed on to kind of federal laws that said that it was really as an anti-kickback, so that no one was benefiting from anything medical. Nobody was making higher profits off of medical devices and prescription drugs. So now if they take that away, and if that was the notion back in 1988, why won't it automatically drive prices back up?
Well, is it okay if I go first, Emily?
Yeah,
okay. House Bill 4689, we refer to it as the co-payment assistance bill. Mm-hmm. What this will enable is the manufacturers of these products to take care of and give a coupon to cover the co-payment that's associated with this drug.
Which is practically, the co-payment associated with the drug.
Yeah.
Well, how much would that be, for instance, on a...
Well, it depends on what your co-payment is with your health plan. And,
yeah,
you know, when you talk about many of these blockbuster biologic drugs, this isn't an issue about generic drug utilization. Massachusetts currently has the highest utilization of generic drugs. Rhode Island was the last state prior to us to not allow this practice, and there is no data.
Why not just reduce the price of the drug?
Well, you need to reduce, that's a bigger problem. You need to reduce the cost to manufacture and invent a drug, and then the cost of the drug will come down. This is an access issue. There are patients out there suffering from chronic illness that can't afford their co-payments. And I believe that organizations like Healthcare for All and the manufacturers of these drugs agree. It's about access. Sure. If a patient can't afford a co-payment, they go without that drug. They cost the system more, and the only group that benefits is the health plan that doesn't have to pay for the drug.
You know, when I started thinking about this today, Wells, I thought, well, now wait a second. The federal government doesn't regulate any other kind of coupon business. I mean, coupons have been around for, decades. And you could make the same argument about a Procter & Gamble product that the coupon gets you stuck on it, and then you go back and you buy it, and you buy it even when you don't have the coupon. So why would you want the government regulate? I know you can't really equate somebody's, health and life and death issues with that, but why would you regulate it for one company and not the other?
Well, you're right, Emily, that coupons actually are very different in a consumer product context than they are in a prescription drug context. You can go out to lots of places and buy consumer products. You know exactly how much you're paying for that product, the total price. With prescription drugs, they are so unsafe that you can only take them under the consent and advice of a physician, and also after they are dispensed by a pharmacist. You have two medical trained professionals making sure that you taking that drug is supervised and you're consulted on important medical issues. Drugs are inherently unsafe because they're serious products and they address serious health issues. So this is one reason why coupons are regulated around prescription drugs, because the federal government plays a very active role regulating the promotion of prescription drugs. And coupons are all about promotion. This is not about helping consumers access medicines. Our organization and lots of others are all about promoting access to needed medicines. Coupons are about driving expensive brand name drugs as opposed to inexpensive generic drugs.
The other part of this, and I read it in my research, I had to take a double take on it, but we started out talking about anti-kickback legislation. If this law is put into place, it says doctors, in a sense, can accept kickbacks. True or false?
No, this is a co-payment assistance bill. That's all this would enable. This will enable manufacturers of drugs to give a coupon to cover a co-payment.
So a doctor gets nothing out of...
The doctor gets nothing. It's not health care insurance. It's covering a co-payment. And the problem with our health care system is access to these drugs. But you have people with multiple sclerosis. You have people that have rheumatoid arthritis that cannot afford their co-payments. If a manufacturer and industry is willing to step up and cover that cost, this is about access.
But not forever, and that's the idea. They're saying that it would be limited, and then they'd be back where they were.
Well, whether it's limited or not, it's pretty important to Mr. Raftery, who you heard from earlier in the segment. It's life or death for these folks.
Why, by the way, Wells, can't somebody like Mr. Raftery go to one of the other states, Connecticut, New Hampshire, Vermont, and fill a prescription there and use a coupon?
Well, that's a good question. I'm actually not sure what would preclude him from doing that. But in his particular case, and other people in that situation, there are lots of programs that drug companies can set up, patient assistance programs, where they recognize that someone like Mr. Lafferty has lost his job, does not have insurance, and needs these medicines. And they do set these programs up to provide these drugs at free or reduced cost on a case-by-case basis or an income basis. But coupons don't do that. Coupons expire, they run out, and what they end up doing is shifting the cost onto people's health plans. And what you have to realize is if you use one coupon for a drug like Nexium instead of taking the generic alternative, then half of your health premium every month is going to pay for one prescription.
But why not allow this, and then, let's say in his case again, once his coupons run out, then he could switch to the other drug?
Well, doctors don't like people switching on and off of drugs. Once you're on a drug that seems to work, they like to keep you on that.
Well, for biologics, there are no generic alternatives. What do you do then? What do you do for the arthritis patient that takes Humira that's manufactured right in Worcester, Massachusetts, where the Beatles are from, and they can't afford their co-payment for their weekly or monthly infusion of Humira? What is the alternative? There is none. And, I think it's ironic that in Massachusetts...
That's not true.
I think it's ironic that in Massachusetts, we mandate health insurance, and we also mandate that we cannot use a coupon assistance program. We're the only state in the nation that doesn't allow it. There's no data that exists that will show that it increases the cost of health care or decreases the amount of generic utilization.
Yeah, Robert,
there's none.
We do agree that some of these drugs are far too expensive. That's absolutely true. But if the drug company is going to respect and honor a coupon, they could just lower the price. That would be the solution for drugs that cost $3,000, $4,000 a month. I was talking to someone today who's on one of these drugs, and it cost her $350,000 a year for this drug. Right? Those prices are outrageous.
It is outrageous.
Yeah, it's a no-brainer. It's a no-brainer. It's about access.
Coughlin, thanks so much. Appreciate you coming.
Thanks.